So hey guys, welcome and welcome back to this video. So have you ever wondered why a notes or prescription written by a doctor or a nurse you can't read? Eh? Like for example, even maybe if you're you are admitted in the hospital and doctors and nurses, nutritionists, therapists, all those medical practitioners are going around to see the patient. You see them talking, you hear them talking, discussing about your condition, but you can't understand anything. You can't understand what they are saying unless maybe you ask them. Maybe is when they can tell you, because it is allowed for you to know your diagnosis, the treatment you are getting, the what is going on. As a patient, you are supposed to know everything that is going around you. So the reason why some of these healthcare professionals usually use these abbreviations is because for privacy. Number one is for privacy. Number two, some of these words are long. They are too long, and also to avoid wastage of time. For example, maybe you have a patient. Let me talk about discuss about something concerning privacy. For example, maybe you have a patient in the ward who is having a cancer of maybe the cervix, cancer of the cervix. Let me use that example. Or maybe you are having a patient who is HIV positive, and now every time that you are discussing something about this patient, you just say HIV positive, this. That patient who is HIV positive, you see, other patients will be curious to know, or they will start building stigma towards these patients. So instead of saying HIV patient, we use another word to mean. You get what I'm trying to say. Instead of saying that patient who is having cancer of the throat, we use another word to replace that, so that we don't make our patient aggressive. Every time you pass patients are looking at you like, this patient is suffering from cancer of the cervix, she's going to die, he's going to die, this patient is HIV positive. So you will never ever understand if you're not from medical school, or if you're not from if you're not a healthcare professional. You will never understand this abbreviation. So in today's video, we are going to talk about I'm going to give you, this one is for medical students, whether you are a nurse, whether you are a clinical officer, whether you are a nutritionist, because even if you're a nutritionist, sometimes we usually go for those word round with the doctors and nurses, so you have to know all this abbreviation. So this one is for medical people, unless you want to know. So I will give you some of the abbreviations that we usually use, that are used in the medical field, that if you're a nurse, if you're a doctor, if you are so long as you are a healthcare professional, what does say? So long as you are in a field of medicine, you're supposed to know all these abbreviations. So I'm going to start straight away. So before that, if you have not subscribed, kindly subscribe so that you learn more. We are going to discuss things related to nursing, things related to medical topics, things related to anything you want to know. Write in the comment section, so that it gives us easy time to prepare and give you the information. So let's start with some of the abbreviations that are I've organized them in what in alphabetical order. Yeah, I've organized them in alphabetical order. I'm just going to highlight some of them, not all of them, because there are so many. And most important, the ones which are common. So number one, if you see a doctor saying or a nurse saying A L L, A L L. I don't know if you're able to see A L L. That the meaning of that is acute lymphoblastic leukemia. Acute lymphoblastic leukemia. Imagine uko na patient mwenye ako na leukemia kwa ward, na every time you say, you pronounce that word, it won't look good. So another one we have AMI, acute myocardial infarction. Acute myocardial infarction to mean this is heart attack. Another one is BLL. BLL. BLL means B cells acute lymphoblastic leukemia. And then we also have FSH, follicle stimulating hormones. This one is common. Follicle stimulating hormone. It is a hormone that are produced by the ovaries. Also, we have HAP, like this, HAP. I'm going to write some of them I won't write. HAP is high altitude pulmonary edema. High altitude pulmonary edema. HPS. HPS is antivirus not antivirus pulmonary syndrome, a type of contagious infection. Also, we have IBS, and that is irritable bowel syndrome. We have IDDM, insulin dependent diabetes mellitus. Insulin dependent diabetes mellitus, especially for people who are having diabetes type 1. We have MDS. MDS is myelodysplastic syndrome. Myelodysplastic syndrome. Let me write it so that you get it right. You know, pronunciation is a problem here. MDS to mean myelodysplastic syndrome. Syndrome, you know how to write syndrome. And then also we have NBCCS. And these things are used in a word. If you're a medical student and you don't know them, kindly make sure you take notes. You can write them somewhere, because you will not always listen to this video, so you are allowed to write them somewhere. NBCCS is nevoid basal cell carcinoma. Carcinoma what? Syndrome. Yeah. Nevoid basal cell carcinoma syndrome, that is NBCCS. Another one is PE, pulmonary embolism. That one is so common. We also have SIDS, sudden infant death syndrome. Sudden infant death syndrome. Most of these diagnoses, doctors usually give them using this abbreviation. And you, if you're a nurse, the doctor has written this abbreviation and you don't know what they mean, you won't be asking the doctor who is in charge, or the doctor who has written that every time, what is the meaning of this. Sudden infant death syndrome is something that is common. If you're a nurse, if you're a student nurse, if you're a clinical officer, you should know. We have TSH, thyroid stimulating hormone. That one I think you know. We have AC, before meal. Yeah, we have AC. AC is before meal, as in taking medicine before meal. AC, AC, before meal, taking medicine before meal. You will be written, the doctor will write, give this patient this drug, AC. And you start looking at the doctor like the doctor has written a Greek word. It is before meal. Give the drug before any meal. Also, we have ACL, anterior cruciate ligament, anterior cruciate ligament. I think it is in the injury, maybe if the doctor is talking about the injured ligament, he or she can refer that as anterior cruciate ligament. Anterior cruciate ligament. I think you get what I'm saying. You can write your question if you have in the comment section. We have AFR, a very common term, acute renal failure. We have ADR, advanced drug reaction, that is common. We have this one, I'm not going to say this one, you already know. We have AKA, above the knee amputation. Maybe you have a patient who is supposed to go for amputation, and you will find that doctor will just write, this patient should be done for AKA, above the knee amputation. My friend, you have to know these things. Also, we have ADH, antidiuretic hormone. We have ARF, that is acute renal failure or acute kidney failure. We have BD or IBD or BID, or BD, twice a day. Take this drug twice a day. The doctor will not write your prescription like give this drug twice daily. The doctor will write the drug should be given BD. You have to interpret and know. Also, we have BKA, below the knee amputation. That is for people who are going for amputation. We have BMP, basic metabolic panel. BMP. We have BP, a very common word. Blood pressure. We have CS, C and S, not CS, C and S, culture and sensitivity. The doctor will write, this patient should go for C and S. C and S, no CS, C and S, and that is culture and sensitivity. We have maybe when the doctor maybe is writing the notes, you will find the doctor or the nurse writing C/O, chief complaint of the patient. CA means cancer. Most of the time you will find the doctor writing CA of the cervix, cancer of the cervix, CA of the throat. Also, we have CC. That is chief complaint of the patient. We have COPD, chronic obstructive pulmonary disease. We have CT, that is chemotherapy, a type of treatment given to people who are having cancer. We have CVA, a very common word, that is cerebrovascular accident or stroke. Instead of the doctor saying stroke, you will instead the doctor say this patient is suffering from stroke, you will get them saying the patient is having severe. Also, we have DCIS, that is ductal carcinoma in situ. It is a type of breast cancer. We have DDX, that is differential diagnosis. DX means diagnosis, DX is differential diagnosis. We have DJD, that is degenerative joint disease, and also we have DM, a very common word, that is diabetes mellitus. We have a DVT, deep venous thrombosis. We have FX, that is fracture. We have HS, that is at bedtime. Take this drug, HS at bedtime. We have H and P, history and physical exam. H and P. HA means headache, and then we have HTN, that is hypertension. We have ICD, it is implanted cardioverter defibrillator. Implanted cardioverter defibrillator. Yeah, IM, that's a common word. Intramuscular injection. We have IV, intravenous injection. We have ITU, intensive therapy unit. We have IU, international units, that is especially for drug. We have JT, that is joint. We have K, potassium, that one you know. We have LLQ, that is left lower quadrant. LUQ, left upper quadrant. We have NV, N and V, N stroke V, nausea and vomiting. Yes, we have NPO, nothing by mouth or nil oral. We have OD, both right eye, OS, left eye, OU, both eyes, ORIF, open reduction and internal fixation, such as with the orthopedic repair of the hip or the fracture. We have P, that is pulse, and also we have P with the somewhat be like this. If you see a doctor writing P with something like this, you should know that it is after meal. PO, nothing by mouth, as in by mouth. You should take that drug by mouth. PRN when necessary or when needed, especially the painkillers and analgesics and maybe convulsion drug. Yeah, we have so many. PT, physiotherapy. Yeah, PUD, peptic ulcer disease. Have QID 4 times daily. We have so many of them. SAD, season affective disorder. We have SQ, subcutaneous injection. We have T, that is temperature. TID, 3 times daily. We have urinalysis UA. Yeah, urinalysis is UA or UA is urinalysis. Upper respiratory tract infection, URI. We have UTI, which is common. That one no. Hakuna mtu ajui UTI. Yeah. So, and the last one we have XRT, that is a radiotherapy type of treatment that uses radiation. So in case you have any question or you want me to show you any abbreviation that you don't know the meaning, write it in the comment section. I will show you, or I will tell you what it means. All these abbreviations are internationally proven. Some of them are used in outside your country. Let me say that, outside your country. Yeah, some of them are used outside your country. Some people doesn't use them, but just know that these abbreviations, they are used in medical field, the whole world. Yeah. So I think I'm going to stop from there. If you have any question, let me know. If you're not subscribe. If you're a nurse and you're not supporting this channel, you're a witch. If you are any medical student and you still want any channel that is dealing with topics related to medical, you're a witch. Can you subscribe, watch the video, ask a question, let us discuss, give me your ideas so that I put them out there. So bye, till next time. Let's meet in the next video.